Hi, everyone. Welcome to the 21st Lupus Summit hosted by the Lupus Foundation of North Carolina. Thank you so much for choosing to attend this session, Practical Applications for Managing Acute Autoimmune Flare-Ups. My name is Daniela Serna, Autoimmune Movement Coach and Health Coach, and I'm so glad that you've chosen again to join me for this session. I will be providing you all with a couple of very practical things that you can implement starting right away. They're very easy to implement for whenever you are experiencing an acute autoimmune flare up. And even if you're not experiencing an autoimmune flare up at the moment, these are all very healthy habits that you can implement to even prevent flare ups in the future. So I will be providing you all of this information through the presentation, and then at the end of the presentation, I will also be providing a way for you to stay connected with me, get in touch with me if you have any questions or would like to discuss anything further that was in the presentation. So let's get started. I'm going to share my screen and I will share the presentation with you all. Okay, so again, welcome to Practical Applications for Managing Acute Autoimmune Flare-Ups. Again, I'm Daniela Serna, Autoimmune Movement Coach and Health Coach for Remade Wellnes. A little bit about me. Okay, here we go. A little bit about me. I'm also a lupus thriver. I've been a lupus thriver since 2008, so 13 years. I have a background in exercise and sports science from the University of North Carolina at Chapel Hill. I started my career in fitness really, I think, from when I was a child. I was always really active in sports growing up, but officially started my career in fitness in 2013 as a group exercise instructor, and then I became a certified personal trainer. And after that, got certified as a health coach and became a business owner in 2016. Since then, I've also worked as a wellness coordinator for Exos and have been certified as a strength and conditioning specialist. And most recently, I have launched full time into Remade Wellness as an autoimmune movement coach. So that is what I am doing now. I'm really passionate about helping other autoimmune warriors reduce flare ups through movement, through breath work, through simple nutrition strategies. My mission is really to help you move well so that you can feel well and live well. Because when we feel well and when we are living well, we're able to love others and the world around us well. Other things about me, I'm a plant mom. You can see my fiddle leaf tree behind me here, and I have a variety of other plants as well. I'm a dog mom to a 4-year-old boxer. I also enjoy blogging and writing. That's one of my other passions, and traveling with my husband. And then also, I really love M&Ms. I love chocolate. So don't let the health coach title fool you. I am a sucker for chocolate. All right, so in this presentation, we are going to cover, here we go. Okay, in this presentation, we're going to cover a variety of topics, but before we do that, I do want to just make sure that everyone understands that I am a nationally certified personal trainer and health coach. I am not a medical doctor. The information that I'm sharing in this presentation is meant to simply educate. It is not intended to treat or diagnose any illness or disease or condition. Like I said, it's provided to to educate you, increase your knowledge and awareness around tools that you can use to implement in your own life for overall well-being. And these are all things that I have learned through my own education, through my own research, and through my own experience, applying these to myself and to my clients as well. So just remember, I am not a medical professional, but I am a health coach. Okay, so topics for our presentation today. We're going to cover what are autoimmune flare-ups, then the difference between acute and chronic, and then I'm also going to talk about the lymphatic system and its role in the immune system. We're going to cover some breathing techniques, what is structured water and why is it important, and we are going to end our session with a little intentional movement session. So for that piece, it'll be the last part of this presentation. You will need a chair and a stick of some sort, maybe like a broom or like a mop, or if you have like some kind of dowel or like a baseball bat or something, any kind of stick will be just fine. And if you don't have a stick, don't stress about it. You can still participate. Okay, so let's talk about autoimmune flare-ups. Okay, what are autoimmune flare-ups? So if you're a lupus patient or a lupus caregiver, which I'm assuming most of you are if you are attending the Lupus Summit, you all know how devastating the impact of an autoimmune flare-up can be just on your mental, physical, and spiritual health, right? A flare-up is an increase in autoimmune activity and symptoms, and you typically don't feel that great. And they can range from very mild to very severe. So today we're going to talk about the difference between acute and chronic. So an acute flare-up is one that has a very sudden onset. It you experience a worsening of autoimmune symptoms, and it can last a couple days, anywhere from like 1 to 5, 6, 7 days up to a week, and then you usually start to feel better, right? So it's this sudden onset. It's very short-lived, and then you start to feel better. And then a chronic autoimmune flare-up has a more gradual onset, and it's a worsening of autoimmune activity. And this one can last several days to months, even to a year. And that's why it would be identified as chronic, because you typically experience this flare-up for a longer amount of time, and typically it requires some kind of medical intervention, whereas an acute flare-up you might be able to just kind of deal with at home. For today's presentation, practical applications for managing an acute flare-up, we are going to be really focusing on the acute flare-ups that you typically, experience over the course of a few days. We've all experienced them, like we, wake up one day and you suddenly feel like you've been hit by a truck, but you have no idea why, right? That is just the nature of autoimmune activity. It is very unpredictable, and sometimes you just wake up with a flare and you just feel like very tired, fatigued, lethargic. You experience brain fog. All of those things would be categorized under that acute flare-up. Okay, so why do we even experience flare-ups in the first place? So there are a lot of contributing factors when it comes to experiencing autoimmune flare-ups or autoimmune symptom flare-ups, right? And there's not necessarily ever like just one thing. It's usually a variety of factors playing together. But one of the most common, in fact, it is like the most common contributor to autoimmune flare-ups is stress, right? So autoimmune flare-ups are really the body's response to stress, and stress is the body's reaction to any change that requires an adjustment or a response. So this stress can be external, either from your environment, from work, from relationships, whatever's going on outside of you can be a stressor, but also things happening inside of you. For example, maybe you ate a food that was inflammatory for your body, and that can trigger a flare up as well. So any adjustment, any change that requires an adjustment or a response from your body would be considered stress. Now, there are good stresses and there are bad stresses, but too much of either of those is going to elicit a stress response from your body. Okay. And it is important to become aware of that, to become aware that stress triggers autoimmune flare ups, because when you become aware of the stressors in your life, or the fact that even stress is contributing to an autoimmune flare up, you then have a choice. When you become aware, you then have a choice to respond differently. Because if you are in this flare up and you have absolutely no idea what is contributing to it, then you can't make a change. But if you become aware of a variety of stressors coming at you, you're going to be a lot more prepared to respond in a very appropriate way that's going to address that stressor. So let's talk a little bit more about stress and its effect on the body. So when you are stressed, your body releases cortisol, adrenaline, norepinephrine, and all of these hormones are our stress hormones, and they are very useful in terms of getting us out of potentially dangerous situations, right? And although today we experience stressors very differently than our ancestors did, our brain still responds to any stressor in the exact same way. So whether you are out hunting some wild animal to bring home for dinner, or you are feeling pressed to meet a deadline at work, your brain and your body are going to respond the exact same way to both of those stressors. Okay, so it's great for survival, not so great for recovery, right? In our society today, while we don't experience as like big and dramatic stressors like some wild tiger coming after us, right? We do experience a lot more of little stressors that add up even more. So things like, sitting in traffic and feeling frustrated, getting to work and dealing with a boss, having to pay your health insurance, or having your drawer full of medical bills that need to be paid, but then you have to also take your daughter to soccer practice, and this, and that. You have all of these little stressors that add up to this much bigger effect. So whereas our more primal ancestors maybe went and hunted their food, and they came home and they had food for several days, so they kind of their body kind of came down from that stress response. Whereas today we are a lot more on the go, so our body isn't as able to come out of that flight or fight response. So when we are stressed, we are operating out of our sympathetic nervous system, and that is that flight or fight response. And when that sympathetic nervous system turns on and stays on, then the parasympathetic, which is our rest and digest, is not able to do its job and help our body come down from the stress. So our feel-good hormones like our serotonin, human growth hormone, oxytocin, dopamine, those endorphins, they're not able to do their job because cortisol, adrenaline, norepinephrine are just on all the time. So that is why it is important to learn how to address our stress so that we can give our body time to come down from that parasympathetic state. And we're going to talk about some ways to do that today. So one of the ways to address stress is to develop a relationship with yourself. And I know that can sound a little weird. You're like, what do you mean? Relationships are about other people, right? Yes, but having a relationship with yourself is just as important. In fact, I believe that it is the most important relationship that you will ever have, is a relationship with yourself. So we as a people have become so disconnected from ourselves that we don't really even recognize who we are anymore. And we spent a lot of our lives very disconnected and distracted by our phones, the TV, social gatherings, things like that. None of those things are bad. We just have are overstimulated. We live in a very overstimulated society, so it's hard for us to even spend time with ourselves. And I want you to think back to when you were a child, when you were a kid, right? You didn't really have a hard time entertaining yourself, right? It was somewhat easy to play with yourself, and if none of the other kids wanted to play with you, you kind of just made up your own game, right? And somehow, through school, extracurriculars, work, other relationships, we have lost that ability to interact with ourselves because we're interacting with our phone, we're interacting with people. And even if there is downtime, a lot of us feel very like anxious, very nervous to sit still, right? So sometimes I hear things like, well, meditation doesn't work for me. I can't turn my brain off. It's, things like that, we feel that it is difficult to sit and be with ourselves because we're so overly stimulated by outside factors. But I believe that one of the most profound things that you can do for your health is develop this relationship with yourself. And if you are asking, where do you start? Start with spending time alone with yourself. And I know that sounds really scary, and it might feel that way at first, but once you put that into practice, it does get easier. And this does require you slowing down enough for you to create that time to have with yourself. And for those of you that maybe aren't working right now or spend a lot of time at home already, and you think like, well, I'm already doing that, I just want to remind you that watching TV or scrolling on your phone, or sitting there thinking about all of the stressors or trauma that you might have in your life, that is not necessarily alone time with yourself. You are distracting yourself by other means. And so I would challenge you to create some very intentional time that is just you, no TV, no phone, no distractions, and just be with yourself. And whatever comes up for you, because I know that for most people, very uncomfortable thoughts are going to come up. Maybe some negative self-talk, maybe some bad memories, things that have frustrated you. I will encourage you to lean into those moments, into those thoughts, those feelings, those emotions that come up without judgment. So allow yourself to experience any and all of those emotions that come up, and simply allow yourself to experience them without saying, no, I can't be angry about this, or I shouldn't be angry, I shouldn't be upset about this. There's no should or shouldn't here. You're just allowing yourself to experience the emotions that you as a person have, because all of those things play together into who you are as a person and to maybe why you're experiencing autoimmune symptoms, right? So it is a little uncomfortable at first, but the more that you practice just being with yourself, the more comfortable it gets. And I think that you will be very surprised at how much you discover about yourself while you work on developing a better relationship with yourself. So something to try. I think that this is a very useful tool in managing stress and assessing the stressors that you have in your day-to-day life. I need to plug in my computer. There we go. Okay. So I'm going to take a quick sip of water, and if anyone has water with them, I encourage you to do that as well. Okay. So we are going to dive into the lymphatic system. And the lymphatic system, I'm talking about this one first because it is the system that most often gets forgotten when we are in school. Even if I think back to like my anatomy classes in college, we didn't really spend a lot of time in the lymphatic system. But in my own studies and research, I have come to understand the great value of the lymphatic system and the significant role that it plays in the immune system. So, the lymphatic system is Latin for clear water. Lymphatic, lympha is Latin for clear water. And I want you to think of this lymphatic system as more like a filtration system for your body. Okay. Now I want you to imagine, I want you to picture like a fish tank, right? This is a really good analogy, I think, to help explain the role of the lymphatic system. So I want you to picture a fish tank, very clear water. If anyone has seen Finding Nemo, you remember the fish tank in the dentist's office when Nemo gets in there. It's very clean. All the fish are happy. You can see the plants in there. You know, all the fish are swimming. They're happy, right? But then they like devised this plan to clog up the filter so that the fish tank will get dirty, and then the dentist will have to take, you know, the fish out of there, and then Nemo can escape. But okay, so we first see the fish tank very clean and clear. The water is very clear. You can see it. But then over time, after they have clogged the filter, what happens to the water? It starts to get dirty. It starts to become like green. There's like brown algae and stuff like growing on all the things in the fish tank, and it just doesn't look very appetizing, right? You wouldn't want to be swimming around in there. Like fish are literally swimming around in their waste, and that is what the lymphatic system does. It is the body's filtration system. It is responsible for clearing out bacteria, viruses, fungi, cellular waste, cells that have died, any proteins or other toxins, right? And when it gets clogged, when that lymphatic system, when the lymphatic fluid is not moving, it gets backed up and your body hangs on to those toxins, bacteria, cellular waste, things like that. And so you have over 700 lymph nodes in the body, give or take a couple hundred, depending on the size of your body, and around 15 liters of lymph fluid that flow through your entire body. And I want you to think about that in comparison to how much blood you have. You carry about 5 liters, again, give or take, depending on your size, 5 liters of blood, whereas you carry 3 times that amount in lymph fluid. So you can see just how important it is. And now when it comes to your immune system and the relationship between the lymphatic system and your immune system, your lymphocytes are kind of the main warriors of your immune system. Those B and T cells in the nodes and those node clusters are what are responsible for getting rid of anything that should not be in your body. So if you look at this picture here, you can see kind of the green, all the green lines through the body. And then if you look like near the neck, the shoulders, the hips and knees, you can really see those, the little nodes there. So those are your lymphatic nodes. And the lymphatic system runs alongside the circulatory system and along your nervous system. So it's like kind of all these, imagine just wires, so to speak, running through the body. But what is different about the lymphatic system is that unlike the circulatory system that has a heart to pump blood all the way through the body, the lymphatic system does not have a pump. It does not have a motor. It relies strictly on 2 things that move lymph. It relies on movement and on breathing. So moving and breathing are crucial for moving that lymphatic fluid through the body. But even sometimes when the lymphatic gets so backed up and it's stuck, it requires some manual pressure to keep that lymph from becoming stagnant. So it keeps it moving, right? So it'll require a little manual pressure, which I'm going to show you today how to do that. So I really like this quote. The body cannot get well in the same environment it became ill within. Okay. Now, illness is a wide spectrum, but we are all here because we are dealing with a chronic illness, lupus, hyperactivity of the immune system. Our immune system is not acting right, so we are here because there's something else going on in the body that has disrupted the normal activity of the immune system. And any illness, the majority of illnesses are mainly due to the stagnation of fluids. So that is when that lymphatic system becomes stagnant, it's not moving, and it cannot clear waste from the body, and it cannot get good nutrients to new cells and things like that. So that is where illness or dis-ease happens, right? We experience discomfort, we experience pain, we get a diagnosis of another disease or something like that. But if we can stimulate blood flow, if we can stimulate lymph flow, the body is able to recover. So if you are experiencing a chronic illness, that is more likely, it is more likely that you are experiencing a lymphatic problem. And a few indicators that you are experiencing a lymphatic problem are chronic pain, chronic fatigue, poor sleep, an inability to lose weight, brain fog. So when you have trouble concentrating, right? Adrenal exhaustion, just when you are just so burnt out from everyone and anything. Slow recovery, easy bruising, delayed onset allergies, red eyes or gray eyes. So all of those are all indicators that there's something not well with the lymphatic system. So when the lymphatic system is not efficient, the body then starts to rely on other vital organs. So think like your kidneys, your liver, your lungs, your skin, and even your body's fat. It starts to rely on those organs to clear off the toxins. And this can increase failure in each of those organs because they have become overburdened. And so when the body is overburdened by toxins, it starts to lay down more fat because it pushes those toxins out into your fat cells to get the toxins away from the vital organs. So laying down more fat cells is going to result in weight gain, but oftentimes that weight gain is actually a very protective mechanism that your body is using to protect your organs, because when your whole system is overburdened by toxins, it pushes out the toxins into fat cells where it is stored. And sometimes your brain and your body do not allow you to lose weight, because if you were to start to reduce those fat cells, your body would release those toxins into your body. And if your lymphatic system is not working well, your body would not have a way to eliminate the toxins that are in your body. So this is why it's really important to first get the lymphatic system working again, get that lymph fluid moving, which will then allow you to lose weight and get the toxins out of your body, so your body doesn't have to store them in fat. That is also a conversation around weight loss as well. But today I'm going to show you all a self-lymphatic drainage technique that you can do at home. It is safe to do every single day. It's called the Big Six. And then we are also going to focus on the head and neck, draining of the head and neck. And I'll explain a little bit more about that as well. So go over to the next slide. So the big six, I'm going to show you exactly where these areas are on the body. But first, I want to just make you aware that as we can stimulate this lymphatic fluid, if you have been experiencing stagnant lymphatic fluid, you might experience a slight headache, a little bit of dizziness, nausea. Kind of feels like maybe you have a hangover because your body is releasing and moving those toxins. So you might feel a little bit worse before you get better. If that is the case, if after we go through these today, you are not feeling very great, you feel maybe like you have a little bit of a hangover, I would wait a day or two until you are feeling better before doing these again. But otherwise, the big six, this technique I'm going to show you is perfectly safe to do on a daily basis. In fact, I encourage you to do it on a daily basis as long as you are feeling well. But some of you might even experience like a rush of energy, like a sense of lightness, and you're going to feel really great right away. So it kind of just depends on where you are. Now, if you are experiencing an acute flare-up right now, I will ask you to hold off on doing the big six and then participate when we do the head and neck lymphatics first. So if you are currently in a flare-up, I will ask you to simply just watch for now and then participate when we do the head and neck in a few minutes. But other contraindications I want to make you all aware of is if you have a localized infection or acute inflammation caused by bacteria or viruses, currently experiencing a fever of over 102, any thrombosis, blood clots, congestive heart failure that is not being treated, any renal failure, or malignant cancer, you're going through chemo or radiation, we'll ask you to not participate in this part of the presentation. Okay. So I'm going to ask you all to stand up with me, and we are going to go through a self-lymphatic drainage technique that is going to help you keep your lymphatic system very happy and healthy and keep that lymph fluid moving through your body as it should. So we're going to stand up. I'm going to move my chair to the side here. Okay, so hopefully y'all can see me here. Actually, I'm going to stop sharing my screen for a moment. That way you can all see me. Hello. And we're going to go through our big six, okay? So the way that lymphatic fluid flows, it's always towards the heart, right? So all of your lymphatic fluid kind of flows in this big loop, and it's always draining towards the heart. So it's really important that we first open up the lymphatic nodes, lymphatic pathways that are closest to the heart so that everything else can flow up, okay? So we are going to do a combination of rubbing and tapping on our skin, and we're going to do these in sets of 10. Now I have to get the questions. Well, can I just do 5 or can I do 15 or 20? And the answer is yes. Okay, so the reps don't necessarily matter. You can do as many as you want. But what is really important is the order in which we do these. And so I'll walk you through the 6 main areas of the body. And it's really, really important that you follow this specific order, okay? So our first point is going to be our collarbone. So if you find your collarbone, it's a very bony area, kind of at the bottom of your neck here. And I want you to place one hand on top. So the hand is going to be above and below that collarbone. And then I want you to rub 10 times. And I want you to press and rub just hard enough so that you can feel the skin move. But I don't necessarily want you to hurt yourself. You're going to rub 10 times, and then you're going to tap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? We're going to go to the other side. So same thing. You're going to place that hand above and below the collarbone, and we're gonna rub 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and tap 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, so that's our first area. That's our first lymphatic pathway that we open up. Our second is going to be behind the ear on the upper neck. So I want you to take 2 fingers and I want you to just feel behind the ear. You're going to feel like a little divot there, right? Yeah, so you're going to place your hand on starting at that little divot, then place your hand down on the side of your neck. You know, if you can kind of almost see this muscle here, you can feel it. So you're going to rub there, and we're going to do 10. 5, 6, 7, 8, 9, 10. And again, you're going to tap. All right, and then we're going to do the same thing on the other side. We're going to do rub 10 times. 1, 2, 6, 7, 8, 10. And then you're going to tap. So we've got collarbone 1, upper neck 2, number 3 is your pec and your axillary, your armpit area. So here, you can go above or under the shirt, doesn't matter. You're gonna rub 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you're gonna tap. And then go to the other side. So again, we're gonna rub 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you're gonna tap 1, 2, 3, 6, 7, 8, 9, 10. Okay, so those are 3 points. We are halfway done. Collarbone is 1, upper neck is 2, pec and armpit area is number 3. Now number 4, you're gonna find your belly button, and you're gonna place one hand on your belly button, and you're gonna place your other hand on top. And you're just gonna rub, and you can rub up and down, side to side, rub 10 times, and then you're gonna tap. 6, 7, 8, 9, 10. Okay? And number 5 is your inguinal area. So if you were to pick up one leg, wherever your hip crease is, that is your inguinal area. So you're just going to rub. So press down and rub. And 10, and then you're gonna tap. All right, so we've got 5 so far: collarbone, upper neck, pec area, our abdominal area, and then our inguinal area is 5, and then the last one is behind the knee. So you're gonna take your hand behind your knee, and you're gonna rub up and down. 6, 7, 8, 9, 10, and you're gonna tap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then on the other side, you are going to rub and then tap. All right, and so that is your big 6. So if you were to wake up one day with an acute flare-up, you suddenly wake up, you're not feeling that great, the first thing you're gonna do is do your big 6 lymphatics, okay? This is going to help to stimulate lymphatic fluid to clear out whatever inflammation is happening in the body that shouldn't be there, okay? And it's gonna help clear your mind, clear brain fog, especially the head and neck lymphatics we're gonna do next. But the first thing you want to do is your big 6, okay? So if you wake up and suddenly you're not feeling so great, do your lymphatics first, okay? So that's going to be first. Okay, so the next part of this presentation, we are going to focus on the head and neck. And I'm just going to sit here so that you can all see this up close. And we have 7 areas on the head and neck. Now the head and neck, you want to do this one about 1 to 2 times a week, or if you're experiencing a headache or a migraine, or again, if you wake up with an acute flare-up, you have a lot of brain fog, a lot of trouble focusing, or you feel like your brain is on fire, due to brain inflammation. Do the head and neck lymphatics first, and then do your big 6 second. Okay, so your head and neck is going to start above that collarbone, and it's going to be the exact same approach. A little bit of rubbing, a little bit of tapping. Now the pressure, the speed, all of that is at your discretion, but you want to do it enough so that you move that skin. So I'm going to start just above my collarbone, and I'm going to rub, and then I'm going to tap. And you can also use your whole hand on here. Typically in this area, I'll use fingers because my hands are like bigger than my face. And I'll do the other side. And then I'll tap. All right, so that first area is above the collarbone. The second area is, again, the upper neck. So it's going to be the same as the big 6. And then on the other side, same thing, we're going to rub. And then tap. Okay, so 1, above the collarbone, 2, upper neck, 3 is going to be under your jawbone. So if you've ever had a sore throat or a cold, you can sometimes feel those like lymph nodes swollen through there. So what I'm going to do is just kind of like rub through here. And then I'm going to tap. This is where using your fingers comes in a little more handy. All right, and then 4 is going to be just under your cheekbones. So you're going to find your cheekbones, they're kind of just like located beside your ear, kind of coming in towards your face. So if you find your cheekbone, you're going to go just down, and you're going to feel that little divot, and through there, I'm just going to rub. And you might feel, if you tend to hold tension in your jaw, this area will feel pretty tender. And then I'm going to tap. All right, and so that's number 4. So 1, collarbone, 2, the upper neck, 3, underneath the jaw, 4, under the collarbone. Number 5 is going to be your smile line. So if you smile, you'll find those little lines. So through here, this is going to look a little funny. You're going to rub. You can even like pinch. Please no one take a screenshot of this. But you can kind of pinch and massage through there, and then again tap. Tap through there. All right, number 6 is going to be your temples. So some of you might be familiar with this area. If you tend to get a lot of headaches, you might find yourself rubbing through here. So what happens is if you rub through here first and all of the other drainage points are blocked, it's not going to do anything for you, which is why you have to open up the other drainage points first, so that whatever is causing tension up here has a pathway to flow out. So this is why, again, the order is really important. And we'll tap. And then last but not least is going to be behind the head, the suboccipital, which is going to be at the base of your neck. So if you kind of find where your skull meets your neck, you'll find a little divot through here. And you're just going to, again, kind of use your fingers to rub through there. And you're going to tap. All right. And that is your 7 points. So we'll go through those one more time. Above the collarbone, 1. Behind the ear, 2. Under the jaw, 3. Cheekbones, 4. Smile lines, 5. Temples, 6. And then base of the neck here 7. So that is for your head and neck, specifically head and neck lymphatics, okay? All right, so again, the next time that you wake up with a flare and you want to just provide enough relief so you kind of figure out what you need to do next, do the head and neck first, and then do the big 6 that we went over before. The big 6 is, like I said, perfectly safe and encouraged for you to do on a daily basis. I do it as part of my morning routine. After I wake up, go to the bathroom, brush my teeth, I run through the big 6. It takes like a minute. And it's just such a very simple tool to promote health and well-being on a daily basis. So I encourage you all to try that and let me know what changes you experience. All right, so I'm going to go back to our presentation here. And so we're seeing again the big 6, the list of the 6. And then here is that the head and neck lymphatics, the above the collarbone, the upper neck, under the jaw, the cheekbones, smile lines, your temples, and then the back of the head. So those are your 7 areas for head and neck lymphatics. Okay, so the next topic that I want to talk about is breathing. I mentioned earlier that 2 ways to move the lymph is through movement. So we just did some manual movement to our lymph. The second way to move lymph is through your breath, okay? And I want you to think about the fact that you breathe over 200,000 times a day. Like, that is a lot of breathing, and most of us are doing it wrong. So I want you to do something for me. I want you to sit up in your chair, place both feet on the floor, and I want you to just take a deep breath and out. And what did you notice? Did you notice your shoulders rise? Did you breathe in like this? Or did you breathe in, out? Did you see like feel like your belly moved out? Now, if you notice your shoulders rise, that means you're an apical breather. You breathe through your chest. If you notice your belly rise, that means you are a diaphragmatic breather. You breathe through your diaphragm. Now, ideally, we would all be professional diaphragmatic breathers. Breathing through your diaphragm allows for more deeper breath, which is going to get more oxygen into your body. But due to stress and anxiety, a lot of things, distractions, we start to over time breathe through our chest. If you ever watch a baby breathe, you'll notice that they breathe more through their belly, and their rib cage kind of expands a little bit more. That is ideally what we want to aim for. So I'm going to show you some breathing techniques. So again, I will stop sharing here so you can all see me. So the reason why breathing is so helpful with lymph fluid is because your diaphragm, that kind of sits right underneath your rib cage, also in that kind of intersection, your cistern chyli, which is your biggest lymph node in your entire body, sits through here. So breathing through that diaphragm, stimulating movement in that diaphragm, is going to help stimulate the lymphatic system as well. And not to mention that getting more oxygen to your cells is going to help your body heal and recover from whatever it is experiencing. So what I want you to do is I want you to take your hands and place them on your rib cage. And when you breathe, I want you to breathe into your rib cage. So I want you to imagine your rib cage expanding in all directions, to the front, to the side, to the back, a very 360 motion. We typically see people breathing through their chest, up, versus breathing out. Okay, so once you place those hands on your rib cage, I want you to just take a couple breaths and think about pressing out against your hands with your rib cage. Notice how my hand's gonna move outward. And one more deep breath in and out. Okay, so during moments of stress, during times of acute flare-ups, I want you to, one, do those lymphatics, and then two, come back to the breath and really focus on paying attention to the breath, okay? Two breathing techniques that I really like to use. In fact, one of them really helped me fall asleep last night. I was having trouble sleeping, and I started practicing resonance breathing, and I fell asleep. Resonance breathing is just a pattern of breathing in and out for the same length of time over 2, 3, 4 minutes, however long you decide. In my case last night, I just sort of fell asleep, so I don't know really how long I did it for. But I want to practice breathing in for 5 and out for 5, and we're going to do a few rounds. And you can go ahead and place those hands on your rib cage again. So we're going to breathe in. Here we go. Breathe in 5, 4, 3, 2, 1, and exhale 5, 4, 3, 2, 1, and again breathe in 5, 4, 3, 2, 1, and exhale 5, 4, 3, 2, 1. Again, breathe in 5, 4, 3, 2, 1, and exhale 5, 4, 3, 2, 1. And you're just gonna repeat that cycle as many times as you need to help you connect with your body enough for you to be able to ask, what do I need today? What do I need to take care of my body? Sometimes when we wake up with a flare-up, it just makes us even more anxious because we have to call into work or we need to cancel things, and that can worsen the flare-up. So taking a moment to breathe, push that lymphatic fluid, get connected with our body, and slow our mind down is going to be really helpful. Okay, so the next technique that I want to share with you is box breathing. So box breathing is a method of breathing in, holding your breath slightly, breathing out, and then holding that breath at the bottom again. So the only contraindication is if you are currently pregnant or you are currently experiencing frequent seizures, I will ask that you just simply watch and do not participate in box breathing for the time being. Okay, so we're going to breathe in for 4 seconds, hold for 4, exhale for 4, and then hold for 4. And we're going to do a couple rounds of that. So you can let those hands rest by your side. You can place one hand on your belly, one on your chest. You can place them on your rib cage, whichever is up to you. So we are going to take a deep breath in. Think about expanding that rib cage, breathing in through the nose. 4, 3, 2, 1. Hold at the top. Relax the shoulders. And exhale, 4, 3, 2, 1, and hold. 4, 3, 2, 1, and breathe in. 4, 3, 2, 1, and hold. 4, 3, 2, 1, and exhale. 4, 3, 2, 1, and hold. 4, 3, 2, 1, and breathe in. And you can repeat that cycle, that 4, 4, 4, 4, for as many rounds as you would like. Sometimes I practice this in the line at the grocery store. Sometimes I practice it in the evening before falling asleep, or just in the middle of the day if I feel like I am not focusing well. I like to practice that box breathing. So either that resonance breathing or the box breathing are really great tools for when you wake up and you're experiencing an acute flare-up of symptoms. It's going to help kind of tell the body like, hey, we are safe. We can relax and heal and recover. Okay. All right. So we have talked about lymphatic drainage. We have talked about breathing as a way to help the body recover from acute flare-ups. And next, we are going to talk about hydration. So let me share my screen again. Okay. Whoops. Okay. So we went over the 360 breathing, resonance breathing, and box breathing. And next we are going to talk about hydration. So when it comes to hydration, it's not about how many ounces of water you drink. It's about how much your body actually absorbs. Okay, so now's a really good time to take a sip of water if you have water close by. So I often see, especially in the fitness field, I often see people guzzling down a gallon of water a day. And while the intention is very admirable, I have to wonder, is their body truly absorbing all of that water? A lot of times, when, you know, we've all experienced this, like when we have chugged water, we then 20, 15, 20, 30 minutes later, we are running to the bathroom and we're just peeing out clear water, right? And oftentimes that water is taking with it electrolytes, vitamins, and minerals that your body needs. So over drinking water, plain water, can actually have the reverse effect, which is why it's important, one, to drink an appropriate amount of water for your body size, but two, also discuss structured water. Structured water is a recipe, and you can also find structured water in fruits and vegetables. I'll explain that a little bit more. First, I want to talk to you about what does dehydration look like, because a lot of us don't even know that we are dehydrated. It looks like fatigue, hunger, brain fog, headaches, joint pain, stiffness, trouble sleeping, bloating, moodiness. What does that sound like? A flare up, right? Very, very similar. So, I'm not saying that for any of you experiencing a current lupus flare up, I'm not saying that, that you're not, but I'm just asking you to consider that dehydration looks very, very similar to a flare up. So, can you really rule that out? So we are often very quick to blame lupus, and we wake up feeling terrible and we're like, oh, it's a flare up. Maybe we're just dehydrated as well. So that's something that we also need to pay attention to. So dehydration can wreak havoc on the body, and it can make you feel like you're having a flare up, when in reality, your body's just really thirsty. On the other hand, optimal hydration looks like quick reaction times, clear thinking, control over your emotions and responses, greater concentration and productivity, and an abundance of energy, right? So wouldn't we all love to have that? So some of the ways that you can increase your water intake is by drinking structured or consuming structured water. Now, structured water is a combination of water, electrolytes, trace minerals, and fiber. Okay, so structured water you can find in fruits and vegetables, but you can also make it at home. So I'm going to share this recipe with you all. Structured water to make at home, you need about 10 to 12 ounces of warm water, a teaspoon to a tablespoon of fresh squeezed lemon juice, a pinch of sea salt, a teaspoon of chia seeds, and then herbs, some fresh herbs if you want to add that as well. So again, I'm going to stop sharing. I'm actually going to demonstrate this for you all. I have here a little setup for you all. So I have some water, some chia seeds, lemon, and sea salt. to demonstrate how to do this. So I actually drink structured water every morning. I call it morning water because it's the first thing that I drink when I wake up. And I just